The questions I would ask before having a vaccine, I'd ask two questions.
Hello everybody, welcome to this conversation on COVID-19 vaccines. I'm really excited to have with us here today Professor Trish Greenhalgh. She is a doctor, a professor at the University of Oxford, and has many notable achievements. I'll just speak about one of them. Remember how when the pandemic started, we were told that we don't really need to wear masks, and then a few months later, we heard that actually masks would be a really good idea. Professor Greenhalgh played a key role in bringing about this change in public health messaging. She campaigned tirelessly, advised the WHO committee which was studying the behavioural aspects of wearing masks, and obviously later we found that WHO, CDC, Public Health England were encouraging people to wear masks. So it's probably safe to say that Professor Greenhalgh's efforts saved many lives. Welcome, Professor Greenhalgh.
Thanks.
First up, the question I want to throw you is, why should people take the COVID vaccine, especially in areas where the transmission is low? For example, in Bangladesh, the number of cases the daily cases have dropped down to around 477. That's the data from January 31st, 2021, compared to almost 2,200 beginning of December last year. The deaths due to COVID-19 have dropped as well. So the figures are not zero, but the overall trend is going downwards. So in that situation, do people really need to take the COVID vaccine? And if yes, why?
Well, the answer is yes, people do need to take the COVID vaccine. Everybody in the world needs to be vaccinated against COVID unless they've got a very specific medical condition that makes the vaccine not a good idea. But the vast majority of us need to be vaccinated as soon as possible. And the reason for that is this virus comes in waves. Where I work in the UK, for example, we had a big first wave of the virus back in March, April, May, June 2020. Lots and lots of cases, lots of deaths. And then the numbers fell to almost none for a few months. It's like, well, there isn't any COVID. I have friends who were working in hospitals. There was no COVID cases. And then it all came back in a second wave. And then that died down a bit. And now a third wave. Mm-hmm. And this is because it only takes one case to infect perhaps two other people. And then those two each infect two, and that becomes 4, 4 becomes 8, 8 becomes 16, 16 becomes 32, and so on and so forth. And within 2 or 3 weeks, you've got hundreds and thousands of cases. So the low level in the population is not a reason to avoid vaccination. And that is particularly true because certainly in Dhaka is a big international exchange center. People travel back and forth from other countries. One person can get off a plane, for example, carrying the new South African variant, the Brazil variant, these new mutations. They're very contagious. And they might then infect many people in your country. Now, we know this. You in Bangladesh have a lot of diarrheal disease because you're in a hot country. You have one child in a nursery who gets diarrhea. All the rest of the kids are going to get it. In the UK, we have the common cold. Same thing in a class. One child goes into the class with a cold, and before you know it, all the kids have got it. So the fact that hardly anyone has the disease is not a reason to reject the vaccine. Now, if I can say the questions I would ask before having a vaccine, I'd ask two questions. Mm-hmm. Is it effective and is it safe? Now, let's be clear about this. The Oxford vaccine, along with the other vaccines that have been approved, is 100% effective at preventing death. If you may get COVID, you may have it very mildly, but you won't die from it, and you won't end up on a ventilator. That's what the research studies show. The vaccine is approximately 75% effective at preventing infection. So you're much less likely even to get a mild disease. And data from just yesterday or this morning released about the Oxford vaccine, it's actually 67% effective at preventing you transmitting that virus to other people. So that's effectiveness. The other question is safety. Nobody has died from the vaccine. It's true that some people in Norway have apparently died after having had the vaccine, but these were very, very frail, very elderly people in nursing homes, and they were probably unable to tolerate any kind of stress. This was highly unusual. We've had 100,000 people vaccinated, and there have been no deaths that have been scientifically proven to have been caused by the vaccine. So it's effective, it's safe, I would have it.
Okay, we will come to the question about the deaths in Norway, but if I may add to this, in areas like Bangladesh and India, we are not having enough tests as well. So for example, in Bangladesh, the tests per 1,000 people is only 0.08. So the numbers that we have now are probably not representative of the actual picture in there. And I would say that it's a much better idea to vaccinate the population when the rate of transmission is low, rather than when it's high, when we're having to play catch up with the virus and the vaccine. And that would effectively cost lives, rather than doing it now and providing some sort of immunity when the virus is not running rampant in the community.
Absolutely. And I think also, if you look at vaccine programs in general, my kids were vaccinated against tetanus, against polio, against all sorts of diseases. None of those diseases were highly prevalent. In fact, it was because of the vaccine programs that hardly anyone in the country has these diseases. But that doesn't mean we should not vaccinate. You're absolutely right. When the prevalence is low, is a very good time to have the vaccine.
Right, okay. So about the safety and effectiveness, people have heard different things at different times about the Oxford AstraZeneca vaccine from those in very prominent positions. For example, STIKO, the Standing Committee on Vaccines in Germany, they said, they decided not to recommend the vaccine in people aged over 65. And then we've heard the French president, Emmanuel Macron, saying that the vaccine is quasi-ineffective in those over 65. While at the same time, looking at the same data, we had regulators from the UK and the EU authorising the vaccine for everyone basically aged 18 and above. So these are scientists who have looked at the same data set and come to very different conclusions. So why should people not be suspicious?
Well, I think one of the big stories about this pandemic has been scientific uncertainty and what we do in the face of uncertainty. Now, when you told me that I was going to be talking about this question, I did some research myself this morning, and let's see if I can clarify. The Oxford trial of the Oxford vaccine included relatively few people over the age of 65. Mostly it was in the under 65s. Now, the vaccine was effective in those people, but because the numbers were so small, the scientists were cautious. However, laboratory data here in Oxford and other places from the over 65s has shown, again, very, very recently in the last few days, that the immune response in the over 65s is as good as the response in younger people. My husband is about to turn 65, and when he gets the letter inviting him for his vaccine, he'll probably get the Oxford vaccine. If I had any doubt at all about the efficacy in the over 65s, I'd be telling my husband, don't get it. But I'm confident. There is a separate question in what we call the old elderly, the over 85s, where all of the vaccines seem to produce less of an immune response. But that's similar with other vaccines, I think. Just like you with an old car, it's not quite as fast as reliable as a younger one. And I think that's nothing to do with the vaccine. That's because as we get older, our immune systems get a little bit more sluggish. So I would still get vaccinated, and the overwhelming advice I'm hearing from the scientific experts, not just in Oxford, but right across the world, is whichever vaccine you get offered, have it as soon as you can.
And also, Trish, the Lancet paper we had back in November about the immune responses, it did actually show that over 80, people aged over 80 are also having similar immune responses as people aged 18 to 55. So I think that's a very good sign that people across different ages can actually take the vaccine. We don't have the data points to understand the accurate efficacy yet, but those will be coming. But for now, what we have, we can say with confidence that people aged over 65 can take the vaccine.
Without a doubt. And of course, they're the people who most need the vaccine, because one of the things that is in no doubt whatsoever is the older you are, the worse you are going to do if you catch COVID. And I speak from bitter personal experience. I went to the funeral of my own mother last week. She was 94 and she developed COVID 1 week before she was due to be vaccinated. She spent some time in hospital and they couldn't save her. She was too old and frail to go on a ventilator. Now, she was 94 and she was very much looking forward to having her vaccine. She had her appointment, but unfortunately, she caught COVID just before her turn came up. So as I say, without any doubt, COVID kills the over 80s.
So we will come back to the reports of deaths after the vaccines. So there have been newspaper reports of people dying after they've received the COVID vaccine, and obviously that has caused a lot of worry among general people. And after these reports are published, some would say that these news articles are given a spin as to saying that yes, people died after receiving the vaccine, but not necessarily because of the vaccine. So is there something dubious going on here? Would regulators tell us the truth? What are the safeguards that people would be told the truth and uncomfortable facts like this would not be hidden so as to make people keep taking the vaccine?
Well, I think I don't have the same mistrust of the regulators as perhaps some people do. I don't understand why the regulators would want to lie to us. I mean, what would they gain from lying to us? If a vaccine causes deaths, then we want to know about it. And I don't see why they wouldn't be honest. And I think if you look at the behavior of regulators, they have pulled drugs and vaccines. A number of vaccines were being developed. And there was one in Australia, for example, that was pulled. It just didn't come up to scratch. So the regulators are perfectly able to take away the regulatory approval if there's a problem. But I think, as I said earlier, there was, I think, maybe 20 or so deaths which happened after the vaccine. But that really doesn't mean it was caused by the vaccine. Someone gave me a good example the other day where apparently if you go down to the beach and go down to the seaside where people are going swimming, you find that the number of drownings correlates very closely with the number of ice creams that are sold. That is not because ice creams cause drowning. It's because when it's a very hot day, people go to the beach and then they buy ice creams and they also go swimming. So, it's correlation rather than causation. And I think we've got here with the vaccination, when you are very old, when you are very sick, it may be that you're going to die quite soon. It doesn't mean that the vaccine caused you to die.
Right, and also, so in that group of people in Norway, they do have deaths of around 400 every week, and the 23 that died were not over mortality from that respect. And as we really vaccinate millions of people, we will have more reports of people dying after the vaccine, and not necessarily we should probably think that, because they've received the vaccine, it caused their death. But we have people dying for many different reasons, even before the vaccine was approved and people were getting the vaccine, and we will continue to see the same after people are vaccinated. And there are very strict rules of how we can identify whether the vaccine caused the disease, caused the illness, or caused the death. And like you rightly said, Professor Greenhalgh, that there is actually no incentive for the regulators to hide this.
That's absolutely right. Absolutely right. And I think what we've got to remember is at the moment, the press are looking for dramatic stories. And because of the vast numbers of people being vaccinated around the world, there are bound to be, some of them are just bound to die because, let's face it, we're all going to die one day. But that doesn't mean that the vaccine is unsafe. I have absolutely no doubt that these vaccines are one of the safest vaccines around, actually. The risks are very, very tiny.
So we will move on to the variants now. We have mentioned this a few times so far. So we are having different variants, and the viruses would keep mutating and might render the vaccines ineffective. So if that is the case, what's the incentive for people to take this vaccine, which might just become ineffective in a few months' time?
Yeah, that's an absolutely great question. So the mutation in a virus happens when it is replicating, when it is doubling, and as we all know, viruses grow and replicate very quickly. Rather than humans, it takes us sort of 20 years to replicate, whereas the virus is replicating, within probably seconds. Now, you're right that there has been talk of the new mutants being less susceptible to the vaccine, but they are not completely, they haven't completely escaped. The overwhelming evidence right now is that the current variants are still going to be prevented by the vaccines. Okay, in other words, the current vaccines, the Oxford vaccine, the Pfizer vaccine, the Moderna vaccine, are all quite effective against the current mutants. They may not be quite as effective as they were against the old strain, but they're still pretty effective. We need to reduce the incidence of this disease so that the virus has less of a chance of spreading and mutating, because it mutates as it spreads. So the idea is we aim for zero COVID. Once we've eradicated COVID, it can't mutate anymore. So without any doubt, the existence of the new variants is a reason to have the vaccine, not a reason to reject the vaccine.
Right, exactly, yeah. So it again circles back to a question of if there's low transmission, should we take the vaccine? So the variants actually give more of a reason to take the vaccine and keep the transmission low still. Another question about masks. You have been championing the cause of masks in our fight against COVID-19, and WHO, Public Health England, CDC, they have also been encouraging people to wear masks. People have been wearing masks for many months now. Now, the question is, if the vaccines are effective in protecting people from COVID-19, why are they being told that they still need to wear masks, still need to practice social distancing, still wash hands? I mean, so is the vaccine not really effective then?
Well, I think one of the reasons why masks are a good idea is that the vaccine is 100% effective at preventing you from dying. It's not 100% effective at preventing you from catching the disease. I had a colleague, a doctor, who was vaccinated a couple of months ago and then developed a very mild form of COVID, didn't cause him any problems, but then members of his own family became more sick. His wife and kids got the full-blown COVID because even though he'd been vaccinated, he passed it on to his family. So that's just one example of why we need to wear masks when we're out of the house, all that kind of thing, because we might still be transmitting COVID-19, even though we are protected ourselves by vaccination against a very severe disease. But the other thing is, as you said, it is possible, indeed it is likely, that in the future there will be mutant variants that are a lot more resistant to the vaccine. And so I think if everybody wears masks when they are in a public place, particularly indoors, particularly when it's crowded, then we will reduce the overall transmission of this dreadful disease much further.
Right. Like you've said earlier, Professor, as well, that we know that this vaccine reduces transmission, but it doesn't reduce transmission by 100%. So we still need to keep doing taking the preventative measures. And as we do that, as the circulation of the virus comes down to very low figures, maybe possibly to zero, and then we can phase out of these preventative measures, but not right now, not when we haven't really had majority of our population covered with the vaccination. So we still need to go on with our preventative measures. It will certainly reduce the probability of us catching and passing it on or becoming really ill with the vaccine, but not down to zero. So we still need to take those precautions for the coming few months.
Correct. Absolutely right.
Right, Professor. So I will ask specifically about the vaccine that Bangladesh is receiving. It's receiving the Oxford AstraZeneca vaccine, but not from here. They will be receiving it from Serum Institute of India. Now, a lot of people are asking why we're not getting it directly from Oxford. Why are we getting it from India? Would it be of the same quality? And there are lots of theories as to the vaccine, say, not containing the active ingredients, just containing saline or water or things that people don't want to be in that vaccine.
Right. I know the Serum Institute in India, that it is an excellent institution. They do good science. You will not get a rubbish vaccine from the Serum Institute. You will get a vaccine of exactly the same quality that would be made in the headquarters in Belgium. They're using the same processes, the same quality standards. And these are scientists that are making this vaccine. They're not. One thing to say about vaccination is it is an international effort. So if we pull back from any reservations we have about particular countries, particular origins, and simply say that this is an international effort to control the spread of the virus so that everyone in the world is protected. And only then can we open up again and go back to what we were doing 2 years ago. We just jump on a plane and go and visit our friends and our scientific collaborators all around the world. I'm very much looking forward to that. But before we do that, we've all got to get vaccinated. We've got to get to zero COVID around the world, and then life can begin again.
Excellent. On that very hopeful note, Professor Greenhalgh, we will end this conversation. But my takeaway from this is, even if there's low transmission and we are not seeing many cases around us, we have safe and effective vaccines. And when our chance comes to take the vaccine, unless obviously we have certain diseases that excludes us from taking the vaccine, we should be taking it in order to protect ourselves and our loved ones and getting back to that mission of COVID zero and getting life back to where we were.
Absolutely. And it's probably worth adding, just as a sort of footnote, there are very, very few diseases that mean that you shouldn't have the vaccine. You can have lots of diseases. You can have diabetes, you can have high blood pressure, you can have heart disease, you can have cancer, that you need the vaccine even more if you've got those diseases. So just having a previous illness doesn't mean that you shouldn't have the vaccine. Even if you've had anaphylaxis in the past, a bad reaction to a food or a vaccine, you need to talk to your doctor about it. There may be a special cover that you need. Maybe they give you some medication to make it safer, but almost everybody is going to be better off with the vaccine than without it.
Yeah, absolutely. And the only really contraindication or the reason for which people should not be taking the vaccine is if they've had a very severe allergic reaction to the ingredients of the vaccine, rather than severe allergic reaction to any food, any medicine, because we do have very good treatment for anaphylaxis, and we are monitoring people for a certain period after the vaccination. So if that were to happen, it should happen within those 15 to 30 minutes. We would not get anaphylaxis, say, 48 hours after the vaccination. Very, very unlikely.
And actually, with the it's fine. It's not as big an issue as people are claiming. And again, nobody's died. Even the people who've had an anaphylactic reaction didn't die. They needed an injection, but they didn't die. Okay.
There's no long-lasting effect from
Nice.
anaphylaxis as well. So I think we can safely take the vaccine and go back to our normal life.
Let's hope. Let's hope.
All right.
Nice talking to you.
Same here. Thank you so much, Professor. It was really lovely having you, and I hope to catch you soon.
And stay safe, everyone. Thanks for listening. Bye.